day everyone. So before anything else, I would like to introduce myself. My name is Meljanet Esteban from BE Ed 1. So my report today is about first aid of common emergencies and outdoor activities. So first, let us determine the different kinds of outdoor activities. There are two. Okay? The first one is the aquatic activities, or the activities usually performed in water. Yan. The next one is the mountaineering activities. These activities is usually performed in mountain. So, this is the pictures. Ayan. So, the next slide, I will show you the different types or the examples of aquatic activities and mountaineering activities. Okay, the first one is the examples of aquatic activities. Okay, snorkeling. Snorkeling is the practice of swimming on or through a body of water while equipped with a diving mask A-shaped breathing tube called snorkel. Or in short, ito yung yung paglalangoy underwater, tapos meron kang suot na goggles. Next. The next is canoeing and kayaking. Canoeing and kayaking is a water sports that involves paddling using a double-bladed oar in a small boat known as kayak. So, simply, canoeing and kayaking is yung pamamangka gamit yung kayak. Kapag pumunta tayo sa mga outdoor activities like in Mexico, you will experience that kayaking. The next one is scuba diving. Scuba diving is a mode of underwater diving where the diver uses a self-contained underwater breathing apparatus or scuba. So, the difference between scuba diving and snorkeling is the apparatus used in diving. Sa snorkeling, ang ginagamit nilang apparatus is diving mask na tinatawag na snorkel. Dito naman sa scuba diving, ang ginagamit nilang apparatus ay yung meron siyang super equipped na tinatawag na scuba. Examples of mountaineering activities. Hiking and trekking. Yan. Hiking and trekking is a long walk involves a long, vigorous hike in wild nature environment for multiple days. It can be done off hiking trails. So, sa madaling sabi, ito yung pag-hike sa mga bundok. Ginagawa ito ng mga hikers. Merong mga taong may hilig talaga dito sa hiking or yung pag-akyat sa mga bundok. Number 2 is camping. Ayan. And camping is an outdoor activity involving overnight stays away from home in a shelter such as tent or a recreational vehicle. These activities, personally, I love these activities. I actually brought my personal tent. For me kasi, yung pagka-camping parang nakaka-strengthen ng relationship ng isang family kung gagawin nyo to sometimes. So, the next one is orienteering. Orienteering is a group of sports that require navigation skills using a map and compass to navigate from point to point to diverse and usually unfamiliar terrain reels moving at speed. I'm not familiar with these activities kasi hindi ko po siya na-encounter or ngayon ko lang siya nakita. So, parang siya yung activity sa mountain na magra-run sila na meron silang point to point tapos meron silang dalalang flag. Yan. Accident. When we heard the word accident, ano ba yung nasa isip natin? what comes first in our mind? And what would be our first action? Panic? Yan. Shock? Or will we run? If the accident happens, ito bang tatlo yung ating unang-unang gagawin? Or ito yung una nating mararamdaman? The best thing to do is conduct the first aid. So first, let's define first aid. What are the common medical injuries encountered in outdoor recreation, and what first aid treatment should be administered? So, we will tackle about common medical injuries na may encounter natin sa outdoor recreation, and ano ba yung mga common first aid na pwede natin gawin. So, first, as I've said, we will define the first aid. First aid refers to administration of care to prevent deterioration of the victim, to aid recovery, and to preserve life. So, hindi ko nababasahin yung nakalagay dyan, pero in short, ito yung mga pwede nating gawin kapag na-encounter natin yung accident or yung mga accident kapag nag-conduct tayo ng outdoor activities. Kung ano yung mga pwede nating gawin para mailigtas yung victim. So, common injuries and illness in outdoor and outdoors and its common first aid. Yun na, common injuries na pwede nating ma-encounter sa outdoor activities. Number 1 is cuts, scrapes, and punctures. So, wounds, cuts, and laceration can be caused anywhere from rock climbing, cutting, self from a high knife, or stumbling. So, yung cuts is hiwa, yung scrape, gasgas, yung laceration is yung laslas ng mga balat, and puncture is yung butas, yung parang tinusok ng karayom. So, ano ba ang dapat natin gawin kapag na-encounter natin to sa outdoor activities? Treatment. Number 1, clean cuts with soap and water, then apply antibiotic cream, then cover with ethereal bandage and secure using medical tape. So, kapag daw po when we encounter that kind of injuries, first thing to do is to clean the cuts. And then apply antibiotic. Lalagyan natin antibiotic and i-cover na natin ng bandage. So, before we're going to do the outdoor recreation, whenever it is or if it is aquatic or mountaineering, the first thing to pack is the first aid kit. So, number 2, if bleeding, apply direct pressure using clean cloth to the injury. Kapag dumudugo daw yung injured, ay lalagyan natin ng bandage or yung pressure para tumigil yung pagdudugo. Number 3, if wound is on the arm or leg, raise limb above the heart to help slow down bleeding. Kapag daw yung wound or yung sugat ay nasa binte or nasa braso, ang dapat natin gawin ay itaas siya yung ka-level ng heart or ng ating dibdib para tumigil yung kanyang pagdudugo. Number 4, do not apply tourniquet unless the bleeding is severe and does not stop even with direct pressure. So, wag nating lalagyan ng tourniquet. Yung tourniquet, yun yung apparatus na ginagamit para tumigil yung pagdudugo. So, kung hindi naman ganun kalala yung pagdudugo, wag na natin siyang a-applyan ng tourniquet. So, emergency personnel must be called immediately. So, kapag meron na tayong na-encounter na mga symptoms, kailangan na nating tumawag ng emergency personnel. Number 1. Severe bleeding or bleeding does not stop despite pressure. So, nilagyan na natin ng pressure yung sugat, pero hindi pa rin tumigil yung pagdudugo. Number 2. You suspect there is internal bleeding. Yung inaakala na natin na meron ng pagdudugo sa loob ng katawan. There is an abdominal or chest wound. Meron ng pagdudugo sa bandang dibdib at saka sa bandang tiyan. Yan, kailangan na natin tumawag ng medical personnel. Number 4, blood spurts out of the wound. Yung sumisirit na yung dugo doon sa sugat. The next common injuries are the sprain, strains, and fractures. So, isa-isahin natin yung tatlo. First is the sprain. Sprain are injuries that involve the stretching of the ligaments. This usually occurs when a joint is overextended from its usual range of motion. So, in short, this injuries is commonly called yung liay. Yung naliay yung ating mga joints, usually in paa. Kapag napamali tayo ng apa or ng step, ito yung common na nangyayari. Yan. Number 2 is strain. Strain is a twisting or pulling of the muscle or tendon. This usually happens when a muscle is stretched and suddenly contracts, such as when one is running or jumping. So, in Tagalog naman, this one is called pilay. Yun. Common to na nangyayari kapag yung mga muscles natin is nabibinat na hindi inaasahan. So, ito yung pilay. Number 3 is fracture. Fractures involves the breaking of the bone. So, ito yung examples ng mga fracture. Nag-break na yung bones or naglinsad na yung bones na. Yun yung fracture. Categories of sprain and strain according to severity. So, merong categories yung strain or yung pakaliay at saka yung strain or yung pilay. At according to its severity. Grade 1. Grade 1 category is mild that involved minor tearing of ligaments or muscle. So, mild lang yung minsan tinatawag natin yun na pagkaigpit ng ugat sa ating yung ligaments. Grade 2 category involves the partial tearing of the ligament or muscle. Kung yung grade 1 is minor, yung grade 2 is partial. Grade 3 category refers to severe injury that involves the complete tearing of the ligament or muscle. So, ito na yung pinaka-severe, pinakamalalang pagkaipit na ng ugat doon sa ating katawan kapag nagkaroon tayo ng injury. Yun yung grade 3. Grade 1 and grade 2 may be treated with rest, ice pack, compression, and elevation or what we call RICE. Para mas mabilis maunawaan, ina-abbreviate siya with RICE. Mamaya, I will show you how to treat like this, yung RICE. This means having the victim rest the injured or painful part, then applying ice pack, compressing, or wrapping with bandage or athletic tape, and finally elevating the injured area above heart level to minimize swelling. So, yun na nga. Explain ko rin yun mamaya. Grade 2 level injuries, however, may need further immobilization to hasten the healing of process. So, when we encounter the grade 2 injuries, ang best thing to do is immobilize yung wag natin gagalawin yung part na na-injured para hindi magkaroon ng panibagong problema. Okay, this is RICE. Rest for R, ice for I, compression for C, and elevation for E. So, So, yung rest helps limit movement that can worsen the injury. So, i-rest natin yung injured part ng victim para hindi magkaroon ng dagdag na injury. Number 2 is ice. Apply the area, reduces swelling and helps stop any bleeding that has to stop effect. Yan. Number 2, apply ice. Meron tayong ginagamit na ice pack na lagayan ng ice. Tatapat natin yun sa injured area para ma-prevent yung injury from swelling or yung pamamaga at saka magtigil yung pagdudugo. And number 3 is compression. Means applying pressure to the area or wrapping with cloth or bandage to help stop the bleeding. So, lalagyan na natin siya ng bandage para tumigil yung pagdudugo. And then, number 4 is elevation. Elevation means raising the injured area above the rest of the body as a way to reduce swelling. So, yun namang elevation is iaangat natin ng bahagya yung part na merong injured para ma-prevent din yung pamamaga at saka yung pagdudugo. So, yan yung rise. Yan. Again, kapag meron tayong mga symptoms na napapansin na hindi na natin kayang kailangan na nating tumawag ng emergency personnel. Ito yung mga sintomas na pwede nating tandaan. Number 1, suspects injury to the person's head, neck, or back. So, yung injury to the person's head, neck, or back. So, yung injury is nandito na sa head, sa neck, and sa back. This part kasi is napaka tawag doon yung critical part. Number 1, bone is sticking out of the skin. So, halimbawa, for example, in fracture, yung fracture niya is lumabas na yung buto sa balat. Kailangan na natin tumawag ng medical personnel. Number 3, bleeding does not stop after several minutes or firm pressure. Hindi tumitigil yung pagdudugo kahit meron na siyang bandage, tapos nalapatan natin, ilang minuto na nating nalapatan, hindi pa rin tumigil yung pagdudugo. And number 4, blood spurts from the wound. Ayun, sumisirit yung dugo dun sa sugat. Kailangan na nating tumawag ng mga emergency personnel kapag na-encounter natin yung mga ganitong pagkakataon. And then, while waiting sa medical help, meron tayong mga bagay na pwedeng gawin. So, number 1, immobilize the area of injury until help arrives or until the person is bring to the hospital. So, immobilize yung isi-secure natin yung area na na-injured. Huwag natin gagalawin hanggang hindi dumadating yung medical or yung emergency personnel na tinawagan natin. Number 2, make sure to clean and dress cuts before splinting. Lilinisin natin mabuti yung injured area at saka lalagyan ng bandage ng mabuti. Number 3, if bleeding, apply pressure to wound with clean cloth until bleeding stops. If bone is pushing through the skin, do not touch. So, yun nga, kapag dumudugo, lalagyan natin ng yung sugat ng malinis na tela hanggang sa tumigil yung pagdudugo. Kapag naman daw yung bone is nakalabas na sa skin, huwag natin siyang gagalawin. Number 4, gently tape the dislocated area or fracture to a rolled up newspaper, ruler, or a rolled piece of clothing with first aid and tape. avoid moving the injured limb, and never force it, even try to twist or back into the place. So, lalagyan natin agad siya ng pwede yung rolled na newspaper or yung ni-roll yun na damit. Tapos, lalagyan natin siya ng first aid bandage o yung first aid tape. And then, kapag yung injured part or yung injured na ugat ay nalinsad, wag natin siyang ipo-force. Halimbawa is nagganon yung buto, wag natin siyang ipo-force na ibalik sa dati. Mali po yun. And then, concussion. Number 3 is concussion. Yan. Concussions is a traumatic brain injury that is often caused by a blow or bump to the head or body. Cuts and bruises may be seen on the head or the face. Some lose consciousness or forget what happened before the injury. Others do not. So, concussions is yung pagkabagok or yung merong force na nangyari sa ulo. Yung iba nagkakaroon ng sugat sa ulo or sa muka. Yung iba naman ay nawawala ng malay. Hindi na nila maalala kung ano yung nangyari sa kanila. Okay? Treatment, kung anong dapat natin gawin kapag na-encounter natin to kapag nag-outdoor activities. Okay? Treat cuts. So, gagamutin muna natin yung sugat kapag mayroong sugat dun sa pagkakabagok. Kung halimbawa nabagok. Number 2, apply ice or compress if no ice is available. So, lalagyan natin ng ice or compress kapag walang ice. Yung part na nabagok, for example, is may bukol. Number 3, rest until symptoms disappear. So, pagpapahingin natin yung patient hanggang sa mawala na yung mga symptoms. Number 4, watch out for symptoms that need emergency action. So, magiging alert pa rin tayo kung ano yung maging kalagayan ng patient. Kung meron siyang mga sintomas, kailangan na nating tumawag ng emergency personnel or gumawa na tayo ng action. Yan, emergency personnel must be called immediately. Ito na ulit. Pag meron tayong symptoms na kakaiba, kailangan nating tumawag ng emergency personnel na mas nakakaalam. Ito na yung mga symptoms. 1, vomits repeatedly. Yung patient is sumusuka na ng paulit-ulit. Kailangan na nating tumawag ng emergency personnel kasi kakaiba na yun. Number 2, the pupils become unequal or nagduduling-duling na yung paningin ng patient, kailangan na nating tumawag ng medical personnel. Number 3, one looks agitated or confused. Yung parang balisa na yung patient tapos nababalisa na siya sa kanyang kalagayan. Hindi na po yun normal. And number 4, one is unconscious or passed out. So, yun na yung isa sa pinaka-worst, yung nawalan ng malay yung patient or yung kasama natin sa paghanik. For example, is in hiking. Yun, kailangan na. Number 5, one feels very drowsy or yung, for example, is nabagok or nadapa. Tapos, after that, nakakaramdam siya ng antok. So, hindi rin po yun normal. Number 5, there is pain in the neck after the fall or knockout. So, sumasakit yung batok or yung leeg. So, hindi din yun normal kasi maybe may mga vein na pwedeng naipit or mag-cause ng pagputok ng ugat. Number 6, there is slurred speech or naggagaragaralgal na yung boses ng patient. Hindi talaga po yun normal. And last, one is experience seizure or yung nangingisay na yung patient kasi itong concussion is very critical kasi yung ulo or yung brain yung affected area. So, kapag nagsi-seizure na yung patient, kailangan na natin talagang tumawag ng medical personnel. para maagapan yung patient. Blister. So, what is blister? Blister are the result of ill-fitting footwear. It is especially seen among hikers and trekkers. Blister can be painful and maybe cause discomfort. So, ako usually, I experience this kind of injury. Blister in Tagalog is yung paltos, like this one and this one. It usually happens kapag hindi komportable yung sinusuot nating sapatos or slippers or bago yung sapatos or slippers. So, kapag nag-long walk tayo, nagkakaroon tayo ng paltos or yung blisters. Treatment. Ano yung pwede natin gawin kapag na-encounter natin to? So, mas maganda na matutunan natin to kasi dito sa atin, in our area, usually, we always, lagi tayo naglalakad. So, kailangan natin to. Number 1, place piece of adhesive over affected area. O, yan. A place of adhesive. So, usually, yung ginagawa natin, lalagyan natin ng band-aid, yung area na merong blister or yung merong paltos. Number 2, if blister have pop, wash area with soap and water, then put antibiotic cream. So, kasi yung blister, usually meron siyang tubig sa loob. So, kapag nabutas yung blister, kailangan natin siyang hugasan. And then, lalagyan natin ng antibiotic cream para hindi magkaroon ng infection. Number 3, if it is absolutely necessary, drain a blister with sterilized needle into the side of the blister. Apply with antibacterial solution and cover with gauge dressing and tape. So, kapag kinakailangan or yung talagang kailangan na, bubutasin natin yung blister sa pamamagitan ng na-sterilize na needle o yung malinis na needles dun sa tabi. And then, lalagyan natin ng cover or yung dressing. Applyan muna natin siya ng antibacterial like alcohol. Tapos lalagyan na natin siya ng dressing para hindi na siya magalaw. Ayan. Burns or scalds. Last, ito yun na yung burns and scalds. Burns and scalds. Burns or scalds are injuries on the skin caused by hot liquid or heat. So, ito namang burns or scalds are pasok or yung scalds ay yung lapnos. It was usually happen kapag napasok. For example, we do the hiking. So, in hiking, usually, at night, we conducted the bonfire. Kapag nagbo-bonfire, minsan, may time na mapapaso tayo. So, ano ba yung mga dapat natin gawin or yung treatment para sa kanila? So, ito, treatment. Number 1, if still on fire, stop burning immediately through the stop, drop, and roll method. Then remove the flame materials from the person. However, if the clothing sticks to the skin, do not pull it out, but cut or tear around it. So, for example, yung po a person is nabanlian. Ang gagawin po natin ay yung stop, drop, and roll method. Yung pipigilan natin, tatanggalin agad natin yung nakakapaso sa kanya. Pero kapag po in case na nabanlian tapos merong damit, yung damit is dumikit na dun sa balat nung patient, huwag nating basta na lang tatanggalin yung damit kasi nakadikit na yun dun sa balat. Pwedeng dumikit yung balat paalis. So, ang gagawin natin is ikakat natin yung part na nakadikit dun sa balat. Number 2, take off constrictive clothing immediately. Belts, jewelry, tight clothing as burns can swell quickly. So, tanggalin agad yung mga belt, yung jewelry, at saka yung mga kung ano-ano pa kasi pwedeng magpalala yun ng apoy. or yung paso. Okay, wait lang. Yan. So, like in strain and sprain, meron ding degree ang burn. The first, wait. I want to give you some trivia. Our skin, ang ating skin ay mayroong tatlong layer. The epidermis, the dermis, and the fats. Yung parang fats na yung nasa ilalim. So, yun. If first degree burn, top layer of the skin is affected. Yung pinakang ibabaw lang ng ating skin, ang apektado ng burn. So, pag yun lang apektado, put affected area under running water or immerse in cool water until pain is subsides. If no running water is available, then apply compress. So, ang first nating gagawin is itapat yung, for example, in our hand, tas ito yung napasok. Itapat agad natin siya sa running water or yung, halimbawa, for example, is gripo. Para hanggang mawala yung sakit. Wag daw yung ice. Yan. Cover with sterile, non-adhesive bandage or clean cloth. Yan. Tapos din, cover natin siya ng malinis ng bandage or ng malinis na tela. Do not apply butter or ointment which can cause infection. So, mali po pala yung kinaugalian natin na kapag tayo inapaso, lalagyan natin ng toothpaste. So, or kahit anong ointment. Yes, nakakais po siya ng pain kasi malamig nga naman yung toothpaste, mawawala. Pero pwede siyang mag-cause ng other infection doon sa napaso. Kaya, ang best thing to do is to running water talaga. Ayan. For the second degree burn, affecting top 2 layers of the skin. So, nandun na sa pangalawa yung burn. Immerse in cool water for 10-15 minutes. Apply compress if running water is not available. Ganon din po yung ating gagawin. Agad-agad nating itapat yung affected area sa running water. 10-15 minutes. O kaya kung walang running water is yung compress. Do not apply ice. It can lower body temperature and may cause further damage. So, kaya pala po, bawal yung ice kasi pwedeng bumaba yung temperature ng ating katawan at mag-cause pa ng ibang damage. Do not break, blister, or apply butter or ointment causing infection. So, wag daw po natin, yun nga, kagaya sa first degree, wag nating lalagyan ng kung ano-anong ointment yung burn para mawala yung pain, pero magkakos naman siya ng infection. Protect burn with a sterile, non-stick bandage and secure with gauze or tape. So, yun, kagaya po nung number 1, lalagyan na natin siya ng gauge or yung mga non-sticky bandage para ma-prevent sa dumi. Yan. Ayan, for the second degree burn ulit. But this time, affecting the top 2 layers of the skin. Ganun ulit. To prevent shock, let the person lie flat and elevate feet for about 12 inches high and elevate burn area about heart level. And cover the person with coat or blanket. So, pag po ganun na yung nangyari, para hindi mataranta yung patient, ang una natin gagawin ay pahigain yung pasyente, tapos i-elevate natin yung part na burn ng 12 inches high, 10 or yung high about heart level, katapat na ating puso, and cover the person with cotton blanket. Then, kumuta natin siya para hindi siya ma-shock. Wait for emergency personnel. Tapos yun, hintay tayo ng emergency personnel. Pakalmayin natin yung patient. For burns, emergently call medical help if the following occurs. So, pagka ito naman daw po yung ma-encounter natin, kailangan na natin tumawag ng mga medical help. Number 1, burns penetrate all layers of the skin. So, yung burns ay lahat na ng layer ng skin is affected. Skin is cracked looking with white, brown, or black patches. So, mayroon tayong makikita na kapag may mga napaso, namumuti na yung balat. So, kailangan na nating tumawag ng medical help. Burn blister is larger than 2 inches or ounces. So, mas malapad na po siya sa 2 ounces yung affected dun sa area. Kailangan na nating tumawag. Hands, feet, face, or genitals are burned. So, ayun, kapag daw po yung ating mga kamay, yung ating mga paa, ang nasunog, ang naging affected ng burning, kailangan na nating tumawag ng medical help. The person is infant or of senior. So, yun po, pinaka-importante kasi kapag po yung infant or senior yung naging patient, kailangan na nating tumawag ng medical personnel kasi mahina na yung pangangatawan nila para sa ganitong mga injuries. So, dito na po nagtatapos. It is yung aking presentation or yung aking report. I hope everyone of us learned from my report. And this first aid can help us kapag kapag nag-decide tayong mag-outdoor activities. I hope this lesson will help you. Thank you and God bless.